quick question. Have you ever looked down at the toilet after you've gone and the water was foamy? Maybe just a little bubbly around the edges. Maybe enough to make you pause for a second. Most people think, fast stream, old toilet, nothing to worry about. And sometimes that's exactly right. But here's what I need you to know before you scroll past this. If you're over 60 and that foam doesn't disappear within a few seconds, your kidneys may be sending you a signal. Not a dramatic signal, not a painful one, a quiet one. And that's exactly what makes it dangerous. My name is Grace Wells. I'm a kidney and diabetes health educator, and I've worked with older adults for a long time. I've sat across from too many people who told me. I saw that for months. I had no idea what it meant. So today, I'm going to walk you through exactly what causes foamy urine, what your body is actually doing when that foam appears, the specific tests that can tell you whether this is serious, and precisely what to say to your doctor to make sure you get it. Stay with me through this, because what I'm going to explain in the next few minutes is information that genuinely changes outcomes, and most people never hear it until it's too late to act on it. Let's start with what your kidneys actually do every day. Right now, as you're watching this, your kidneys are filtering your blood. Every single minute, about a liter of blood passes through them. They pull out waste, balance your fluid levels, regulate your blood pressure, protect almost every organ in your body. And one thing healthy kidneys do, very deliberately, is hold on to protein. Protein is not a waste product. Your body built it, uses it, needs it. So the kidney filter, a structure called the glomerulus, acts like a very precise net. Waste goes through, protein stays behind. That's the design. Now here's where foamy urine enters the picture. When that filter gets damaged, from years of high blood sugar, from uncontrolled blood pressure, from chronic inflammation, from the natural wear that comes with age, it develops gaps. Tiny at first, invisible, no pain, no signal. Then larger over time, and protein starts slipping through into the urine. Now protein does something specific when it mixes with water. It reduces what's called surface tension, the same mechanism that makes dish soap create bubbles in your sink. Protein in your urine creates foam. The more protein leaking through, the more persistent, the more dense that foam becomes. So when you see foam in the toilet that sits there 10, 15, 20 seconds without dissolving, that's not a plumbing issue. That's a potential sign that your kidney filter is breaking down. Here's what makes this particularly serious for people over 60. As we age, kidney function naturally declines, even in people who are otherwise healthy. By the time most people reach their late 60s, they may have already lost 20 to 30% of their peak kidney capacity. That's not a disease, that's normal aging. But here's the problem. When you layer diabetes on top of that, or long-term high blood pressure, or both, that baseline decline accelerates significantly. And the kidneys don't announce it? Most kidney damage has absolutely no symptoms in the early stages. No pain, no swelling, no fatigue, nothing obvious. The kidneys are remarkably good at compensating. They work harder, they adapt, they stay quiet, even while the damage accumulates. By the time you actually feel something, a significant portion of kidney function may already be gone. Foamy urine is one of the few early visible signals the body gives you. And because it doesn't hurt, because it looks so harmless, most people ignore it for months, sometimes years. I had a patient I'll call Margaret. She was 69, diabetic for about 12 years, reasonably well managed. She mentioned almost as a footnote one day, "Oh, I've had foamy urine for a while now. I figured it was nothing." We tested her that week. Her result came back at 410. I'll explain exactly what that number means in just a moment, but I'll tell you this up front. 410 is not early stage. 410 is already in serious territory. She had been seeing that foam for over a year. Every morning, dismissed it every single time. That conversation changed what happened next for her. The right medications, the right dietary adjustments, close monitoring. Her numbers came down over the following months. But we were working against time we didn't need to lose. I want this conversation to change something for you before that clock starts. The test is called the UACR, urine albumin-to-creatinine ratio. It's simple. No fasting, no IV, no hour in a waiting room. You collect a urine sample. That's it. But the way you collect it matters. You want your first morning urine. Before you've had anything to drink, before you've walked around the house and been active, here's why that matters. During the day, normal physical activity pushes a small amount of extra protein into the urine, even in people with healthy kidneys. That can make results look slightly elevated when there's no actual problem. First morning urine reflects what your kidneys are doing at rest. That's your body's true baseline. That's the sample that gives you accurate, reliable information. Now what the test actually measures. Albumin, the most abundant protein in your blood, and creatinine, a waste product that stays relatively constant throughout the day. By comparing those two numbers, doctors get a reliable picture of how much protein your kidneys are leaking, even from a single sample. Here are the numbers you need to know. Write these down if you can. Normal, below 30 milligrams per gram. Protein is staying where it belongs. The filter is intact. 30 to 300, this is called microalbuminuria. The filter has started to leak, but this is the early warning zone. This is where intervention actually works. This is where you have the most power. Above 300, macroalbuminuria. This means significant filter damage has already occurred. The conversation with your doctor at this point needs to be serious and immediate. Now I want to focus on that middle range, 30 to 300, because this is where most people get failed by the system. They get this result and they're told simply, "We'll monitor it." Monitoring alone is not enough. In this specific window, the right changes can genuinely slow the progression. Sometimes they can partially reverse it. Blood pressure brought under tight control, ideally below 130/80. Blood sugar stabilized if you have diabetes with an A1C target your doctor sets specifically for you. Sodium reduced, because excess sodium forces the kidneys to work harder to maintain fluid balance. Protein intake adjusted, not eliminated, but calibrated. And then there are medications that specifically protect the kidney filter. SGLT2 inhibitors, drugs like empagliflozin and dapagliflozin, were originally developed for diabetes but have since been shown to slow kidney disease progression even in people who aren't diabetic. ACE inhibitors and ARBs, blood pressure medications, do more than lower pressure. They physically reduce stress on the glomerulus, the filter itself, which gives it a chance to partially recover. These are not small interventions. These can determine whether someone's kidneys hold out for another 20 years or deteriorate in 5. But they only happen if you know your number. Let's come back to the foam itself, because not all foam is the same, and I want you to know how to read what you're seeing. A little bit of bubbles when the stream hits the water, gone within 5 seconds, almost certainly just physics. Turbulence. Normal. Dense foam, like the surface of a freshly poured beer, still sitting there 30 seconds later. That's worth paying attention to. Thin foam that clears quickly in the morning but appears more frequently lately. That's a pattern emerging. Still worth a conversation with your doctor. And if it's happening consistently, not once after a long hold, not once after a high-protein meal preen, but regularly, most mornings, regardless of what you ate the night before, that's a pattern. And patterns mean something. There's also a completely separate situation that I want to make sure is clear before we move on. If your urine is dark brown, tea-colored, or you can see any trace of blood, that is not make an appointment this week. That is call your doctor today. Dark or bloody urine can point to kidney stones, infection, acute kidney injury, or other conditions that some of which need urgent attention. None of them are things you observe and wait on. Now I want to take a moment because I know some of you are not watching this for yourselves. You're thinking of someone, a parent who's been diabetic for years but doesn't ask questions at doctor's appointments, a spouse who waves off every health concern, a sibling who hasn't had blood work done in longer than either of you can remember. If someone came to mind just now, and I think someone did, this video will still be here when you finish watching. You can send it without a long explanation. I watched this and thought of you is enough. Sometimes that one message is the reason someone gets tested in time. Let's talk about how to actually get this test, because I've seen this play out the wrong way too many times. Someone notices persistent foam, they mention it to their doctor, the doctor orders a standard urinalysis, it comes back normal. They move on. Here's the problem. A standard urinalysis is not the same test. It can detect large amounts of protein, but it will miss early leakage entirely. It does not calculate the ratio. It does not give you the number that actually tells you what stage you're at. You need the UACR specifically, and the way to get it is to walk into that appointment and say exactly this. I'd like to check my urine albumin-to-creatinine ratio. Not, can you check my kidneys? Not, is my urine okay? Those phrases leave room for a general answer. When you use the clinical term, your doctor understands immediately that you've done your research, that you know what you're asking for, and that you're not going to walk away satisfied with something vague. That phrase will get you a more specific, more useful conversation in almost every case. Now, if you have type 1 or type 2 diabetes, this test is not optional. It should be part of your annual care every single year. If you have high blood pressure, same standard applies. If you're over 65 with either of those conditions, or both, this number should already be in your medical record. If it isn't, you now know exactly what to ask for. One thing I want to address directly because it comes up in almost every conversation I have with patients. A lot of people feel embarrassed, like they should have caught this sooner, like they should have pushed harder years ago. Like somehow this is their fault. And I want to be very clear. The reason you didn't know is because nobody told you. This is not information that gets explained in a standard 15-minute appointment. There isn't time, and most primary care doctors aren't specifically trained to walk patients through early kidney warning signs in this kind of detail. Kidney disease doesn't announce itself. It doesn't cause pain. It doesn't feel like anything for a very long time. By the time it does feel like something, the conversation is harder. The fact that you're here, watching this, taking the time to understand what's actually happening inside your body, that is the right move. That is exactly the kind of thing that changes an outcome. Let me leave you with the 3 things I actually want you to do after this. First, pay attention to your urine the next few mornings. Not obsessively, just notice. Is there foam? How dense is it? How long does it take to clear? Second, if you have diabetes or high blood pressure and you've never had a UACR, or if it's been more than a year since your last one, write down this phrase before you close this video. I'd like to check my urine albumin-to-creatinine ratio. Take that to your next appointment. Say it out loud. Third, if you already have a UACR result somewhere in your records and you've never really understood what the number means for your specific situation, don't leave that question unanswered. Call your doctor's office, ask for clarification. Push. Early intervention is the only thing that actually preserves kidney function, and early intervention starts with knowing your number. In my next video, I'm going to walk through what happens after that test. what the different results actually mean depending on your situation, whether you're diabetic, whether you're already on blood pressure medication, whether you've had any previous kidney concerns. I'll also cover the questions most people never think to ask, but absolutely should, before they leave that appointment. If you want to be ready for that conversation, and I think it's worth being ready, you'll want to see that one. I'm Grace. Take care of those kidneys. They've been working quietly for you for a very long time.